Then we'll put a towel underneath. Okay, so, here we go. Okay, perfect. Now, this is what the catheter looks like. Now, there's usually not this much hanging out, but this is the catheter tube, and this is what it connects to, and it's draining to a bag. Okay? The bag must always be lower than the bladder. Okay? If I go like this, urine is going to go back into the bladder, and the bladder is sterile. Okay? So your patient will get a urinary infection. Okay? Well, not for sure, but likely. Okay? So in everything you do with your patients, every time you get them up, every time you're doing any movement, it has to stay below the bladder. The other thing is that we always secure this with tape. Okay? We don't tape this, we tape the tubing. Okay? And you obviously need to make sure that there's enough give so that your patient can move their legs. And remember, for men, penis size doesn't stay the same throughout the day. So if it's too tight, that's going to really hurt. Okay? So we'll make sure and check that we have this secured well. So catheter care, we're going to put some gloves on. Okay? We're going to spray our rinse where?
Over the perineal area.
Okay, and do we spray? What did we talk about last week?
The cloth.
Always on the cloth. Okay, I see people do this, like, horrific. Okay, so we're going to spray this. It's a no rinse. So what am I doing? Walk me through this.
Side.
One side, new section of my glove. Other side, okay, new section of my glove. Then straight down over the vagina and urethra. And now what I'm going to do is I'm going to secure this right at the urethra, okay? And I'm going to clean down the tube. There's a balloon inflated in here. If I just go like this, it's going to pull and yank at the bottom of their bladder, okay? So you have to take your fingers and secure that tube and then clean down the tube. Okay, and that's for males or females, the exact same process. Obviously for males, you'll retract the foreskin as far as it will go, okay? You'll clean. Do you remember, what did we talk about last week? In a circular manner, very carefully, working out towards the glands, then down the shaft of the penis, okay? Then we'll get a new section of the cloth, we'll secure the tubing, and we'll go down.
Aren't those cloths like kind of rough though?
Yeah, they are.
And that's the same ones they use?
That's what we got.
Oh my god.
Yeah. So that's why I'm saying you're not like scraping. That's why you have to sort of dab. It's a very sensitive area.
And right now we're just doing care for catheter. We're not.
I'm going to show you how to empty it right over here.
But we're not inserting.
No.
That's
1 to 8. I'll show you.
second semester, third semester, so.
Next semester. I think you guys are coming to me. I think I'm
Scary.
I'll show you how to do it.
Awesome.
Alright.
If things change, but right now I'm scheduled to do it.
That's what we want.
Oh, very nice.
We want, Angela.
Okay, so any questions about that? Alright, now let's go over here. I'm going to show you how to empty this. Okay? So, it's really important to think about PPE. Okay? I'm going to get down. There could be some splattering. Okay? So I want to make sure I have gloves and some goggles. I know this seems a little strange, but anyways, okay? I'm going to take something that has a graduation in it, and we usually use these because they're disposable when their patients discharge. We throw them away. So I might have like Smith here, so then I know this is his hat, is what we call it. This is a hat.
So we understand testing, yes, put glasses on.
Yeah.
When you're in the hospital, do you have those on?
I wear it because I'm not nurse. Because one day I opened this up and it splattered and it hit me right here. Right there. I was like, oh! Yeah. So, I mean, not that that's going to help that, but I keep my mouth closed now. And then I'm really hoping that this might help. So you might want a whole, like, hazmat suit. I don't know. You make that judge. The hospital policy says that you wear these.
Okay.
Okay? Okay, so I'm going to get down here. Okay, now I'm going to lift this up. Now, this is a no-no, right?
Yep.
But I need you to be able to see what I'm doing. Okay, these bags are clipped in here, okay? So I'm going to just loosen these clips. Oh, here we go. There, okay? Nothing will happen. Well, do you see how it's already dripping? There could be some residual dripping. But to empty this, I need to pull this little clip down. Right here. So I'm going to take this and push down with my thumb. Okay, so I'm going to just let some out. So So I'm emptying it. And then to stop it, I just push that back down, and then I put it in here.
But you need to empty the whole thing.
Oh yes, but you're
Yeah,
gonna do
yeah,
that.
yeah.
Okay, so you guys can just take an opportunity to let a little bit out, just so you can feel what it feels like. Make sure you have gloves on. Okay? Now you can see what's on the bag, but we don't use this because it's a little wonky. This, whatever you get on your graduation for your hat, that is your output. Okay? How do you feel about that? Okay? Good. Now I do have a male catheter here. So if you need to practice the catheter care, then you can practice here.
Be the same
Whatever,
thing.
same thing. I just some people need the hands-on, and I can appreciate that. Okay. Whew.
Good job.
Your face.
Awesome.
So sweaty.